By 2030, 1/4 of California's population will be 60 years and over. California is getting out in front of this major demographic shift, leading the way in communities across the state.
Housing for people, economic security, health, and making sure that people stay healthy as they age. We have a large older population that's going to need care.
We want to make sure that our seniors are safe and that they're healthy and they have proper nutrition and they have the resources they need to cope with modern society.
Dignity, respect, ensuring that they're not lonely, ensuring that they have a place to go, a normal course of life, and they're not forgotten.
The master plan for aging is going to give every community a blueprint as to what it can do to help not just our aging population, but those folks who are going to be aging.
And it gives us a starting point to collectively mobilize action. What I also like about the Master Plan on Aging is it's very comprehensive, so it's covering everything from social connectedness and belonging, to housing policy, to healthcare, and it really recognizes that there are a constellation of factors that impact whether or not someone ages well.
As our population is getting older in this state, I think it's very critical that we integrate our communities and our services and everything we do to serve Californians of all ages and abilities, really.
To get all of our county departments to be more age-friendly, and when they do their policy decisions, when they implement programs, to look through the lens of aging and disability.
And I believe that the master plan for aging is going to accomplish those goals. Obviously, it's going to take a lot of work on everybody's part, but I'm looking forward to seeing the implementation because it's going to be a great benefit.
Regional coalitions, together with local leaders from across 50 California counties, urban and rural, inland and coastal, are engaging their communities to make the Master Plan for Aging's 5 bold goals a living reality for millions of Californians. Marin County is moving forward with the Master Plan for Aging through strong community collaborations to ensure equity and access to supports for older adults with disabilities.
As our community has changed and evolved, we've aged into disability as a community. We have a expanding and widening service and support network and caregiver network, recognizing that older adults and people with disabilities in our community need significant long-term services and supports.
They're all coming together today to learn, just to network and find out about collaborations. We're doing a deliberate table assignments so that people from different sectors who don't know each other yet will have a chance to meet each other and be talking across their silos.
I am really excited about where we're heading. There's a lot to be done. We're doing it as people with disabilities, as people with lived experience, and we're leading this effort in Marin.
The Master Plan on Aging and programs that are supporting the independent living movement and disability justice programs are vital in this move forward as we age, because we know that our population is going to be predominantly older.
It was during the power shutoffs and the North Bay fires, and we were just launching our Powered and Prepared program to distribute batteries and resources to individuals with disabilities who relied on medical devices. And I recall dropping off a battery with my son, actually, to a mother and son in Marin City. They were definitely isolated. The mother was older. The son had Down syndrome. They were left behind. It was a reflection on me on how much more our community could be doing for families with disabilities, as well as our most marginalized and lowest income community members.
Contra Costa County's Master Plan for Aging Coalition engaged with local leaders to help secure a local half-cent sales tax to provide $2 million a year for 'for senior and disability services and supports.
2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and disability services and supports. 2 million a year for senior and dis
If you invest in services in the community, people can live in the community.
چندتر بسیار خوش هستم برای یک سرسایت هست با خیاطی با گپ زدن هر چیزی یاد میگیرم بسیار خوش هستم چندتر بسیار
от души, с удовольствием прихожу сюда. Нравится то, что действительно культурно обходится с нами, объясняет, где что есть, что надо. Ой, не знаю. Сидел бы дома и что-то делать.
We really design all of our programs and services around the needs of the people that we're serving. And we're unique because we have a Russian program, we have a Farsi program, we have an Alzheimer's program, we have a general program. And each of those are designed very differently around the people and what their needs are.
Housing, transportation, all of that are important things that I think need to be looked at when we're looking at a master plan for aging. All those things impact whether we're in an institution or outside of an institution.
This is an opportunity for all communities across Contra Costa County to realize that there are best practices, there are best policies, there are ways that, and things that we don't know.
My hope is that other counties and communities take the blueprint opportunity at the state level to increase policy and funding at the local level, so that we can see implementation happen where it matches what the needs are in our communities, because what we need in Contra Costa is radically different than what folks need in Chico.
Butte, Glenn, and Shasta counties are moving forward with the support of a state aging and disability planning grant and the Rural Master Plan for Aging initiative to address rural needs, including new collaborations around emergency preparedness, rehousing, transportation, and trauma recovery.
Our region has experienced 20 FEMA-declared emergencies in the last 5 years. So now when we bring this into the scope of long-term support and services, we now have an additional layer added to what we were already doing, helping the community thrive, regrow, rebuild, move into aging, move into adequate care at any age.
I got burned out in Paradise. You can see the fire coming, but I didn't realize it kind of hit where the hospital is, and the fire brands that jumped over town that came up the canyon took my place out.
Butte County had a housing crisis before the fire, and then after the fire, it just got ridiculous. Post-disaster, prices of housing skyrocketed because of lack of supply and overwhelming demand. And, there's a lot of people disproportionately affected by that, but older adults on fixed incomes definitely are.
We got some real good social programs and helped me buy this place, and that was a big one. So then Home and Heart getting set up with a roommate, and I just looked for a stable situation.
I got a hold of Home and Heart, and they found me a roommate and a great home to move into.
So an older adult might need help aging in place, like Bob might want some companionship, might want some financial resources to be able to stay in his home. And then Andy, someone who's also looking for companionship, someone who's also looking for affordable housing, gets to meet and they get to participate in this match.
Transportation is a huge gap. They have to travel to get some of the medical care they need. They have to travel to get the specialty physicians, such as neurologists even. And so that's a huge gap.
With the vision problem, it's not as easy as, just getting on a bus or calling a cab and going to the store. Northern California is just gorgeous, the mountains, and I want to experience that. I want to be able to go hiking and just see the beauty.
Ventura County launched a local master plan for aging in 2022 and is building cross-sector collaborations in local government and among stakeholders, leading to systems change, including innovative solutions for goal number 4, caregiving that works.
I think we're somewhat of a unique county in that we have an extremely active area agency on aging. One of the things that has come out of this is that we have developed a caregiving coalition in the county.
We always think outside the box. How can we reach more
caregivers, more, how can we reach more individuals out there?
We realized there were so many people who did not even know what the caregiver centers were and where they were located and what they did. Working across the sectors has strengthened relationships.
So because of the master plan for aging, we have had more agencies come together, and the word about the Caregiver Center is spreading. So we are seeing more people being referred to us. We have more warm handoffs from agencies, but we're also seeing more individuals from the community.
It's just so good to have a place where you can walk in the door and say, this is what's going on. What do you know about it? How can you help me?
Living Well, Caring Well is an initiative that started as part of the Master Plan for Aging for resources for older adults. Every quarter, we set up these one-stop shops throughout the different parts of Ventura County, so that it's easier for the different caregivers and the individuals with dementia-related disorders.
Having all the different services and things that are available within Ventura County is huge. I know I didn't know anything about what was available back in the 90s when my grandmother was first diagnosed.
A California for All means that people living with Alzheimer's have access to a timely diagnosis, resources that are culturally and linguistically appropriate to them, and make sure that our caregivers have access to education, respite care, and services that allow them to properly serve their loved ones in their community.
I love my parents. I want to see them age with dignity, and I want to make sure that they enjoy the remaining years that they have on this earth.
Mi sueño sería que a las personas de edad e incapacitadas se les diera su lugar en esta sociedad, que se les cuidara, que se les diera su puesto, que hubieran organizaciones que se concentraran en toda la ayuda que uno necesita cuando está ya de edad avanzada o incapacitada.
It is our hope, it is the dream, it is the desire, the vision of the Master Plan for Aging and our age-friendly work that people will have a community where they have better access to housing, where they have better economic security, where they're not so socially isolated as they've experienced in recent years, and where they can feel a part of the community and respected and included, regardless of their background or current circumstances.
Our hope is that the Master Plan for Aging can create a more coordinated system of care that looks at the well-being of our older adults through a broader lens. We're talking about social services, meeting health services. We want individuals to thrive in the setting of their choice.
Imagining a more age-friendly region where older adults are valued not only because of the wisdom and the experience that they bring, but also everything they bring to the community and to our lives.
We can address systemic issues like affordable housing, equitable caregiving, where caregivers can live at a living wage and work and live in the community. When we can address the digital divide and ensure that everyone has the access to services and supports.
We can either kick the can further down the road and hope that somehow things get better because we're counting on it being done at the federal level, or we will have used these fantastic ideas, these innovative programs, and we have figured out a way to get them in place so that when we look to 2030, when those of us that are here are still here at 2030, we will be really proud of what we've accomplished.
We're seeing real investments and initiatives taking root in communities all over the state. We've made billions of dollars in investments in affordable housing. We've expanded Medi-Cal coverage for older adults 50 and above. We've lowered the age for adult protective services to 60. Those changes are already taking place. It's truly a national movement, and California's out in front.
It is a service coming from people who are so loving that they have to give to others in the community which don't have the blessing.